Well, motherhood is one of the most special times in a woman's life, but sometimes pregnancy itself can do a number on a woman's body. Today we're talking about some popular procedures that's getting a lot of women back to their pre-mommy figures. And joining us now with more on these mommy makeovers is Dr. Michael Deckard with the San Antonio Plastic Surgery Institute. Good morning, Dr. Deckard.
Good morning, Bridget.
I call you the mommy magician.
Well, thank you.
Helping mommies get their mojo back.
Well, thank you.
Yes. Let's talk about some of the options mommies, I guess, have, because when they come in, they're not feeling really good, and they come to you, and voila.
Well, you know, I see a lot of women who are in their 30s and 40s who have had a couple kids, and they look good, but they're at the gym and they're working real hard, but there's some things that they don't like that pregnancy has done to their bodies.
Sure.
And typically these involve some deflation of the breasts, and they've got a poochy tummy, and you know, all the gym workouts in the world isn't going to fix separated fascia on the inside, and a lot of women don't really know this. And so and some of these women never really thought they'd be coming to see someone like me, but they just want to feel better about themselves.
Yeah,
so,
because the reality is that your body just changes and it stretches and it does all sorts of things that once you get it back, it's just not like it was. One of the popular procedures are the tummy tucks. You're taking stomachs and skin that have been kind of stretched and kind of making it new again, if you will.
Right, and so a lot of women have some stretch marks, and they've you know, a tummy tuck takes away skin and fat, and some people ask about liposuction, and on the tummy, that's only going to remove fat, so a lot of people really need a tummy tuck. The other thing a tummy tuck does that people don't realize is that it repairs the fascia on the inside and makes the inside a lot tighter. So.
Now, are there women who come in, Dr. Deckard, who aren't perfect candidates for this kind of surgery?
Well, you know, patient safety is the first thing we always look at. This is still medical procedures, and so it's not just like buying shoes. We want to look at, make sure they're healthy, and if somebody's not healthy, we'd rather defer a surgery than take on somebody where we're going to cause a problem.
Now, I've got to be honest with you, Dr. Deckard. I saw the before and afters when we were doing research for the show, and it's dramatic. I mean, I saw bodies that looked like they'd taken 10, 15 years off. I mean, just that youthful appearance had come back. Another popular thing is breast augmentation. Talk about that.
Well, you know, some people, you know, breast augmentation is the most popular surgery in plastic surgery. A lot of people think that if you have breast implants, you're going to look silly, and there are some women who maybe do look silly, but there's a whole lot of women who have breast implants that look really natural and normal.
Who want a natural appearance.
And for a lot of women, it's kind of restoring what you had that was maybe lost after pregnancy. And so certainly there's a role for judgment and patient selection and how these things work.
And certainly that's what you all focus on at the San Antonio Plastic Surgery Institute. I know you've brought some things here you want to show as far as breast augmentation go with the silicone implant. That's usually the one of choice?
Well, you know, it's totally patient choice. I did bring a couple implants. This is a saline implant, which is filled with salt water, and this is a silicone implant. Well, there's a lot of misunderstanding about silicone implants.
Now, give me again, this one is the
saline.
Saline, and this is the
silicone.
Okay. And
so these were off the market for a number of years, but
yes, there was a lot of fear about them, doctor.
Right, and when they did the science I can't get into all of it right now, but basically the short answer is they said we can't find any evidence that these cause any systemic problems in women.
Really? So they're safe.
And they've never been off the market in South America and Europe, and these have been put in a whole lot of women and have really been pretty safe.
I bet you've seen a lot of women who are pleased after they think, oh, I don't know if I want to do it, and then once they've had it done, they feel a lot better about themselves.
You know, it's amazing the difference that this makes in women's lives, not just implants necessarily, but a lot of people think that women's pursuing cosmetic plastic surgery, I get this perception that we deal with vain and needy women, but really there's a whole lot of women who are just a mom next door, who is a normal person who says, I don't like this thing about my body, and if I can help them fix that, it makes such a difference in some of these women's lives. It's really fun to see how much happier they
Never had one of these before, Dr. Deckard. It's the first time for me.
All right.
Let's talk about recovery time. Once you come in and say you have the tummy tuck, you have the breast augmentation, what is your recovery time? What are you looking at?
Well, the breast augmentation tends to be a quicker recovery. I have a lot of women who feel like the next day they've pulled a muscle. I want them to take it easy, but they can still go about their business and do their normal things.
Wow.
Tummy tuck's a little more of a recovery. The sewing up of the muscles does cause a little more pain, and usually that first week's a little rough, but they start feeling better in the second week. And then the nice thing about that is the tummy tuck's going to last.
I'm telling you, those results are just phenomenal. We had the pictures up in our office, and we were just going, wow. Let's also talk about Botox as an option for women with some issues of skin and aging?
Well, a lot of these women in this age group don't really need anything surgical for their face, but they come in and say, you know, I'm seeing some wrinkles, I'm seeing some lines, what can I do about it? And so we have some things we can do in the office, which are typically Botox and fillers to help with some of the fine lines and you know, do some non-surgical things in the office.
And let me ask you how long the results of Botox last, Dr. Deckard. Say you get an injection, you're going to be good for what?
Botox lasts about 3 months. Now, I do feel like if people do it regularly, because it works on the muscles that cause wrinkles, over time, it's like if you had your arm in a cast for a year, even when you took it off, those muscles aren't going to be kind of strong. So the textbook answer is it lasts for 3 months, but I do feel like it has an additive effect over time.
And I know one of your specialties, Dr. Deckard, is making things look natural, the tummy tuck, the breast augmentation, and the Botox, because you hear so many stories about Botox and women look like they can't, but you're all about the natural appearance, and that's what's awesome, I think.
Well, thank you.
Yeah. So a lot of women coming to see you. I know you're booked and want to get more folks in there, helping mommies look good. San Antonio Plastic Surgery Institute. Go see Dr. Deckard. He's at 540 Madison Oak Drive, Suite 600. Or for more information, you can give him a call at 495-4100. He's going to give mommies that body back. The bam, bam. What is that, Dr. Deckard? The
bam.
The bam. All right. Well, what does a naked cowboy and an M&M have in common? Dish is next. Stay with us. We'll be right back.